joints, these facet joints, they come out of alignment. See, like this. Then it gives pain. If you put back into the alignment, your pain will be gone. When it is out of alignment, all muscle problems, joint problems, all mechanical dysfunction will happen. So simply what do we do? Put it back into the alignment. When all these things are in line, your body will work optimally. So in assessment, what do? We do palpate the spine. If everything is falling in one line, it is aligned. Suppose this vertebra is gone little left. Then what will happen? When you put your line, fingers in one line, you miss one. Then it is gone either left or right. Then again you move your fingers left. If you touch it here, left. If it is gone right, you will find it on the right. So it is rotated on the right, left or right, that you have to find out just by palpation. Okay. This skill takes many months to acquire. It is not that easy. So literally, both the PSIS, it will fall in the line of S2. Okay. Because here ilium is not shown, so PSIS will fall in the line of S2. From there you count S1, L5, 4, 3, 2, 1. Like that you have to calculate in the beginning. Later on, when you become efficient, you can touch like that. You can count instinctively. So when it is gone either left or right, that you have to calculate. So first we will see L5 over S1. L5 has moved either left or right. So one thing I told you, just by palpation you can learn whether it is gone left or right. Also it can move superior and inferior. That will come later. First one step, one thing, left or right. Rotation left, rotation right. So when it is gone to right, bring it to left. Gone to left, bring it to right. Very simple. Opposite motion. Then you can see in the X-ray whether it is aligned or not. Another option beside palpation. Confirm both. Then third thing, leg length test. Lie down in front. I want to open on this side. Okay? So what I will do, on my chest I will take his head and distract. So never give more than 45 rotation. Just rotation 45 and side flexion, distraction. It will come out. Here you have to pay attention that don't flex the neck. That is wrong. Keep it neutral. Otherwise, what will happen? When you are passing the hand without knowing you are flexing the head, that is not required. Pass and here lightly. Don't push it. And 1 and 2 and relax.
Sir, नहीं okay sir. Sir, नहीं okay.
Hold like this, closer. And rotate, distract. Done. नहीं डोसे, तकाली डोसे.
नहीं डोसे, पूरी डोसे.
मसाला डोसे.
मसाला डोसे. एकदम non-stop he can speak. One over the transverse process of force, other one over the height. Breathe in, breathe out. Breathe in, breathe. This is vertically down. 1, 2, and 3.
Apa seri?
Here, and down. Here it is vertically down. Here. Another way, if you want to put axillary down, 1, maintain traction, done. And SC joint here, cross hand. Breathe in, breathe out, breathe in, breathe out, done. Give thumbs up. One finger width, here you get posto transverse joint. Put your pisiform. Reinforce. And press. Breathe in, breathe out, and super. Bend and get up. With this, you can pull the heavy objects also, or heavy subjects.
Light adalikonga.
Breathe out. Here, PSIS is S2, S1, and this is L5. And breathe in, breathe out, breathe in, breathe out, 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 out. Again, breathe in, breathe out, 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 out. Okay. Did you feel?
He is pulling with free.
Right forearm
Force flow.
Core is static, high moving. Okay. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Now lock is taken up. Okay. And she is flexible.
Body fit time
Now breathe in, breathe out. One. Magic. Breathe in, breathe out. With breathe out, it will thrust.
breathing பண்ணு
Breathe in பண்ற ஆல்ட்ட.
breathe out பண்ணு breathing breathe out
What's the name?
breathing
With a sing-song voice, you have to use bolo. Bolo beta.
பண்ணிட்டே செய்யணும் சார்.
1, 2, 3, Medua, Solunge, MGR, Valge, like that. This way. And this way. Hold.
கால் மூவ்மென்ட் இந்த புகர
And 3 and 4. 1, 2, and done. It is basically L1, L2, L2, L3 distraction manipulation. Okay? And somebody hold the table here. It should not jump.
செலைட்டா. தெலிகோ.
Give me another pillow. If it is opposite gender, keep a pillow.
Okay.
Because she may not like your touch. This hand like this. One above the shoulder, one below the shoulder. And get a perfect hold. And I will give hip extension. Breathe in. While coming back, breathe out. Smile pan rahi hai. Now you have to say 1, 2, 3 like that. Bolo beta 1. Bolo 1.
Say 1, 2.
2. Loud मतलब long.
Relax.
Say 2. Not short. Long. 3. Bolo.
சொல்லுங்க.
Say, relax.
4. This is for relaxing you. 5 and 6. Done.
Which hand supposed to be on top? Which hand supposed to be down on the shoulder?
As per your convenience. Close it. Basket grip.
No, for her.
For her,
She's
center.
supposed to hold this hand this way, right?
Any side. Whichever you are comfortable. Okay. 1 minute.
See your hold.
Now you walk and see.
bilateral pain.
Come bilateral pain. Here. suppose this side upslip is there, that is pre-decided in your diagnosis. So I want to pull it down. Just hold it above the ankle and pull with your body weight. One, two, and three. It will relocate. Okay. So two therapies are required, one for stabilizing, one is operating. You have to take permission from her. Love, pillow love.
Pillow.
आगे. Limb, this one will be extended and this will be flexed. And with your consent, I am touching your ischium. Okay? And to hold like this, 1, 2, and 3. Forcefully send it up. That is downswing flex. If it is not happening in one sitting, try it next day in another sitting. It will relocate. So anterior correction, posterior correction, superior, upslip, downslip. Tummy, ukare. Hold. You have to fatigue the external rotators of the hip joint. Can you tell me which are the external rotators of the hip? Anyone? Yes. Gemellus superior and inferior. You more? No. Obturator, yes. Internal, external, gemellus superior and inferior. Piriformis, one more. Quadratus femoris. Okay? These are 6 external rotators. What have to sit like this? And ask her to rotate. Open the clamp. Open. Forcefully. Relax. Again. This way you have to do 15 times. Full force. Again. Again. Now assume that we have done 15 times. Next step. Put your fist here. Press forcefully. Again. Again. When she is doing this, with click sound will come, and which is like this will reset. That is symphysis pubis correction. It happens because of misstepping in uneven ground. When somebody is walking through the mud roads, uneven potholes, and there happens misstepping. So symphysis pubis will subluxate, and it will give very bad pain in your perineal area. And you cannot tell your mother-in-law, you cannot tell your husband, this lady is cranky, doesn't want to work, so he's telling like that. Doctor will give tablet will work 4 hours. It's a mechanical problem. Unless you correct it, so once correction is done, you have to give a sacral belt for 6 months. Special belt is available that she has to wear for 6 months. After that, it will heal. So she will be thankful for this technique, because doctors will avoid doing surgery on that. For minor, they will consider it's a minor issue. ठीक हो जाएगा, अल्लाह मालिक, जाने दो. And it ऐसा है कि it doesn't leave you. Neither it is so big that you will operate, neither it is so small that you can ignore. It is in between. So there you are. If you know this technique, correct it. If it doesn't work in one sitting, it will work in 2 or second or third sitting. It will definitely work. Then apply the sacral belt for 6 months. Then it is done. Without surgery, you are a good surgeon. Purida, never forget. Most of the ladies who suffer very much. Got that? So SI over. Shall we move to
shoulder?
now? What we have to do? Suppose this side SI joint is anterior. This you have determined by seeing the back side. From the midline, if it is away, it is anterior. Closer means posterior. So keep her close to you. This side.
मैम टेलीकॉम हो
Pass.
मैम
थोड़ा स्पेस दो भाई. Breathing space. Take this leg and this is called ankle lock. Right? Cross your fingers like this. Take it behind your occiput. And take it here. Hold the shoulder. Make a C. C बन गया?
सी
Okay? Close your eyes. Pass your hand like this. Hold the elbow and hold the scapula. Rotate and hold. And at the same time, hold the ASIS. Make it tight. Breathe in, breathe out, and when slack is taken up, breathe out, thrust. So when it is anterior with the thrust, it will go posterior. Got it? Did you feel anything? Okay. So his spine is properly aligned. There is nothing wrong. Okay. Then suppose if his vertebra is moved or SI joint is moved anteriorly or posteriorly or it is moved left, suppose whichever side, you will talk about lumbar spine. If lumbar spine L5 is moved to the left, what will happen? This side fascia will pull it up. So this side shortening will be there, little. 5 millimeter to 10 millimeter shortening will be there. So in this case, shortening is not there. So it is perfectly aligned. In some other case, we'll see again, there may be shortening. You don't have any back pain? Keep hands up below. Okay. The leg, suppose, which whenever we want to put in for manipulation, the painful side should be down. Suppose in this case, pain is on the right side, means it is rotated towards right. Okay. So the right leg will be extended like this, and this is called knee lock. First step, knee lock, leg extended. Then head down, and I'll pull the upper body into rotation like this in one pull. Up and little bit abduction. Now flex the elbow, lace your fingers. Second step. And block the shoulder. And this is on the pelvis. Now I will catch hold of the S2. Here it is S2, S1 and L5. My finger is over L5 and S1. My forearm is over the pelvis. So thrust will come from pelvis and upper body is fixed. Okay? Now I am preparing you by giving rotation. Okay? Breathe in, breathe out. With breathe out, I will pull. Breathe in, relax. Breathe out. Breathe in, breathe out. Like that you are preparing the patient. You know how much excursion is there, that you find out, right? Once again, breathe in, breathe out. Breathe in, breathe out, out, out. Done. You heard the click, very loud sound. So L5 moved over S1, right to center. Then make him lie down for 30 seconds. We need two therapies. One therapist over the foot, better. And hold the knee properly. Don't allow it to move. And I'll pass a towel. And I'll pull in. You push this direction. I will pull in this direction. 1, 2. Again.
ठीक है चाहिए
Stabilize the foot. One, two.
Slippery band, sir.
सुमन
कोई बात नहीं.
उन्होंने पूछ रहा साटा
So this will distract the femoral head away. This is another one. Then another technique, serious technique is there. If hip is stuck in a particular position due to loose body, it is not moving into full flexion. It is held up here in between. So what you have to do? To remove the loose body, you pull the ankle and internal. Then again lift it up, traction and internal flexion. Then after doing 2-3 times, check the movement. If it has moved away, then range will increase. If it is not moved, try the next method. This time we'll move external, traction, lift. So this way, if you do few times internal, few times external, then check the range. That loose body would have moved from that position and range will be increased. So this is a temporary management till the time that loose body is removed arthroscopically. Permanent management is arthroscopic removal of loose body. Temporary management till the time he goes to the hospital. This way you can manage, right? Similarly, in the knee, you can have loose body here. So internal, or external. Then check the range. Okay? This way it can be done, right? Okay. So hip and knee done. Now I will show you ankle manipulation. Hold it like this over the ankle and pull. Position. One. ऐसे ही हो गया. Done. चलो ankle manipulation करो. You have to lock the C1 C2 with your hand and check movement between. No, movement is fine. There is no restriction. But still you have a headache. Chalo, lie down in prone. Prone. Both the hand behind. Head down. And here, palpate the occipital protuberance. And 1, 2, 3. Relax. Ab ud jao. How do you feel now? Sound is coming? Fun type. Ringing sound. That means this thrust worked. Anybody else want to feel it? Some old, sir, you come.
So what's the mechanical
Definitely because of age, this gets jammed.
He claims he is very young.
Young, yeah, me too. I'm only 50. Very young. Lie down, sir, in front. First, I'll check your neck. Yes, restriction is there. Thoda sa. Lie down, in front. Hand behind. Little down, sir. Head, forehead down. Straight. Find out occipital protuberance and 3 thrusts. Done. हो गया सर. Thank you, sir.